My name is Tommy Curry. I am registered by the ARRT in Radiology and CAT scan. Prior to working here, I was in the Air Force for 9 years. I went to college and ended up dropping out of college and joining the Air Force. After 9 years of traveling in the Air Force, I got tired, ready to settle down, so I started doing a lot of research in what I wanted to do. Job shadows, family members in radiology that I talked to. Really figured that this was what I wanted to do. Or I went back to Clarion, and they had a program where I can finish out my 2 years at Clarion and then do a 2-year clinical site. The only kicker was you had to get accepted to a clinical site. I got accepted to Clearfield Hospital School of Radiology for my clinicals. After 2 years there, I applied to Penn Highlands Elk and got a job up here. After about 6 months here, I started on-the-job training for CAT scan. All the training was provided in-house. A couple months of CAT scan training, and then getting all of the prerequisites done for ART. About a year later, I took my ART registry for CAT scan. My main responsibilities here all evolve around the patient, whether it be patient care. All has to do with doing what's right for the patient. From patient care to minimizing the patient dose to making sure we do the correct scans on the patient, all to provide the quality diagnostic images. Some of the biggest challenges you face can be the patients themselves. They're here for a reason, whether it be sick or injured or something, so positioning can be a challenge. Infants and geriatrics and bariatrics can all be a challenge, trying to get them on the table, getting them to hold still, trying to follow instructions. What I enjoy most about this job is the patient interactions, the helping people. Makes you feel good at the end of the day. We don't make any diagnosis or anything like that, but by providing the proper quality of care, getting the quality images for the radiologist, and just being there for the patient, at the end of the day you can feel like you did something and help somebody. For people coming into this line of work, I recommend that they do job shadowing. Talk to people who have been in this line of work. You're going to be doing, especially in a hospital setting, you're going to be working weekends, holidays, off hours. What skills I most frequently use would be patient care, all the technical skills that you learn in school as far as keeping the dose as low as reasonably achievable. And interacting with your coworkers, keeping it in a fun environment. An average day as a CAT scan tech usually always consists of an outpatient schedule that goes every half hour, along with trying to squeeze in ERs as they come and occasionally inpatient. The pace can get pretty intense at times, and there's always usually something to do. Outpatients are scheduled on a half hour. A typical patient would include getting the patient properly dressed on the table. First you check their order, you get them dressed, verify the order with the radiologist sometimes depending on what study needs to be done, if there needs to be contrast or not. If the study requires contrast, we're responsible for placing the IV and going over the contrast questionnaire with the patient to make sure that they can in fact have the contrast, check their kidney function, all that. Once we get the patient on the table and scan them, we gotta make sure that we get quality images. There was no motion or anything like that before we send them. And all of this needs to be done in a timely manner so that you can be ready for the next patient. I commute to work. I live about an hour away. I drive to and from Brookville every day. I love the downtime before I come to work. It gets me in the mood. I'm always in a good mood when I walk through the doors here. Sometimes I wish I had less downtime on the way home from work, but it's a necessary evil. I love it here. I love the people I work with, and I wouldn't trade it for anything.